So today is an immensely important day for the 1 million Australians with some form of eating disorder. As of today, patients will be able to receive 60 Medicare funded treatment services a year for eating disorders. 40 with a psychologist, 20 with a dietitian, and it's a $110 million investment, but it's much more than that. It's an investment in life-saving treatment coupled with the nearly $70 million for residential eating disorder treatment centres around the country. And we've worked with Butterfly, with Christine Morgan in her role formerly with the Butterfly Foundation, but now as the CEO of the National Mental Health Commission and the Prime Minister's Suicide Prevention Advisor. Christine, what will this mean for patients and people facing the challenge of eating disorders?
Look, I think this is a seismic shift, and in talking to people with eating disorders, what has mattered to them so much is the recognition that the disorder, which has been hidden for so many years, is now recognised as being a very, very real one, that complex and specific care is needed, and this package actually addresses the needs to go to a GP, to go to a dietitian, as well as to get your psychotherapy. It's such a seismic shift, and I think people are finally realising what a difference this will make.
So to all of our patients and their carers, their families, their supporters, this is the moment where we bring eating disorders out of the darkness and into the light, where we provide the support which has been so needed for so long, and we say that there is real hope and a pathway to recovery.
For the past 7 years, Butterfly has advocated tirelessly and worked with government and our partners and colleagues in the eating disorders sector to achieve today's milestone. We wouldn't have been able to achieve any of this without the courage of many Australians with a lived experience of an eating disorder. We truly are a focused community dedicated to improving the lives of people affected by eating disorders. Today is one of those rare moments when we can celebrate an extraordinary achievement and reaffirm our commitment to continue to raise awareness of the needs of those living with an eating disorder, as well as what is needed across our communities to be able to respond earlier to the warning signs and symptoms of these serious mental illnesses. We would like to acknowledge all Australians with a lived experience of an eating disorder and those who care for them, the sector and the government for the significance of this landmark achievement.
I speak on behalf of my fellow clinicians and treating specialists for eating disorders, GPs, psychiatrists, psychologists and dietitians. Today is a significant moment in our ability to respond to and treat Australians with an eating disorder. Having a public health insurance program like Medicare in Australia is the foundation to provide treatment for eating disorders to thousands battling anorexia nervosa, bulimia nervosa, binge eating disorder, and other eating disorders. Evidence and experience in treating eating disorders tells us that we need to be able to provide multidisciplinary treatment over a long period of time for serious eating disorders. These treatment plans provide us with that ability. The new Medicare items are underpinned by the National Practice Standards for Eating Disorders, which promote a coordinated, evidence-based, consistent and multidisciplinary approach to the treatment and management of eating disorders within Australia.
Thank you, Minister Hunt. Thank you to everyone who was involved in making today a reality for hundreds and thousands of Australians. For anyone with an eating disorder, like the one I battled for years, being able to access the right type and right amount of treatment over an extended period of time is the best way to tackle these very serious mental illnesses.